Hello, Kelly Williams here, exercise physiologist, founder of Entirelyfit, and certified holistic wellness coach with the International Association of Wellness Professionals. And I help men who are really just tired of being overweight and out of shape with a plan to look and feel their best. And today I want to talk about how to reduce your back pain. You know, many men suffer from back pain, whether it's a one-time incident or something that comes and goes over time. And if you have suffered back pain, especially low back pain, you know how it can affect everything in your life. It can affect your work performance. It can affect your activities of daily living. It can certainly affect your relationships if it's really interfering with your ability to enjoy your activities of daily living and participating in things that you would do with your family and your friends and your spouse or your significant other. And so back pain can really cause a lot of problems. Now, the first thing to do is, if you know how you hurt your back, definitely if it's not going away in a few days with just simple light activity and stretching and maybe ice and some over-the-counter pain medicine, if it's not going away in a few days, or if it's getting worse, definitely it's time to see a professional. Now, whether that's your family practice physician, a physical therapist, or a chiropractor, you can choose based on your experience with care with those individuals. But get in with a medical professional and try to identify what's going on and put together a treatment plan. The good thing is most of the time the issue is resolved in just a few weeks to a few months, depending on how the type of injury you have. When I was in college, I hurt my back lifting weights, and from that time forward, I've had, it seems like about every, 5 or 10 years, I have an episode of recurring back pain that really limits me for a few weeks. And, fortunately, I typically know how to manage it with some exercises that I do. But sometimes I still need to go and see a physical therapist and get some additional help. So the main thing is to realize that most of the time it gets resolved, and typically you can manage it with exercise, weight management, and and some relaxation techniques. So there are many causes. Sometimes back pain is caused from, an injury, like a fall, or maybe a car wreck, or it could even be from lifting something and you hurt your back. It can be caused, by arthritis. It can be a musculoskeletal issue. Sometimes those are the result of an injury. And that could be disc related, it could be ligament related, it could even be a muscle strain. But typically when those injuries occur, it really affects everything that you do, and you get tense, you have trouble with movement, and it can hurt when you sleep, it can hurt when you sit, it can hurt when you stand. So you really, for until you start finding a treatment to help you, it can be very frustrating. So see a professional, get on a treatment plan, definitely work with your treatment professional on some exercises that you can do, and typically those are going to be some flexibility exercises and some strengthening exercises to help manage that problem. And then over time, continue to do those things. Be involved in a regular exercise plan for cardiovascular stamina and strength, and then also continue to do your back exercise program. And more than likely, you'll be able to manage this over time. So, if you have chronic back pain and you're not seeing a professional, definitely do that so that you can get on a plan and manage this and do all the things that you want to do. Typically, if you're having difficulty managing your back pain, then it can lead to decrease in endurance. It can lead to decrease in strength. It can lead to having less flexibility, and then it can also create issues where you gain weight, and then you're in this vicious cycle of less activity, more weight, less energy, poor sleep, and those are all things that really interfere with your quality of life. So get with a professional, learn some exercises to do those exercises and add other exercises into your plan, and learn how to manage your back pain. So because so many back issues are unique or different, it doesn't make sense for me to share specific things that to do, because that might not be appropriate for your typical or for your specific injury. So just follow those steps, get with a professional that can diagnose and put together a treatment plan for you, and then put those things into action. So until next time, be well, be grateful, and keep trying to be entirely fit. Have a great day. Bye.